welcome back to Women of Color
Color
TV. And
TV.
I'm your
And
host,
I'm your host,
Marsha Jew.
Marsha Jews.
And they're making me look at
And
the
they're
camera
making me
because
look
I
at the
just
camera because
refuse
I
to do
just refuse to do that.
that. I'm here
I'm
with
here
Ariel
with
Ash
Ariel
Shakor,
Ash
and
Shakor,
she
and
won the
she
Professional
won the
Achievement in
Professional
Government.
Achievement in Government
She
Award.
is a
She is a
biomedical engineer
biomedical
with the
engineer
United
with
States
the
Food
United
and Drug
States Food and
Administration.
Drug Administration.
Dr. Ariel Ash
Dr.
Shakor
Ariel
has
Ash
made
Shakor
remarkable
has made
contributions
remarkable
in the field
contributions
of
in the field of
interventional
interventional
cardiovascular devices.
cardiovascular
As
devices.
a lead
As a
reviewer at the
lead
U.S. Food
reviewer
and
at the
Drug
U.S. Food and
Administration,
Drug
Ash Shakor
Administration, Ash
plays a
Shakur
pivotal
plays
role
a
in
pivotal
the
role in
evaluation
the
and approval
evaluation and
of numerous
approval of
medical
numerous
devices,
medical devices,
clinical trials, and
clinical trials, and manufacturing process
and
changes,
her
and
expertise
her
and diligent
expertise and
evaluation
diligent
ensure the
evaluation
safety
ensure
and
the safety
efficacy of
and
these critical
efficacy of these
healthcare
critical
innovations.
healthcare innovations.
Ashakor's research work
Ashakor's
has been
research work
widely
has been
recognized,
widely
earning her
recognized, earning
prestigious
her
accolades
prestigious
such as the
accolades,
National
such as the
Science
National
Foundation's
Science
Graduate
Foundation's Graduate
Research Fellowship
Research
and
Fellowship
the
and
Syracuse
the
University
Syracuse
Orange Circle
University
Award.
Orange Circle
Her
Award.
dedication
Her
to advancing
dedication to
knowledge in the
advancing
field of
knowledge in the
biomedical
field of
engineering
biomedical
is
engineering
evident in
is
her
evident
achievements.
in her
Beyond her
achievements.
professional
Beyond her
endeavors,
professional
Ash Shakur
endeavors,
is
Ash
a
Shakur
passionate
is a
advocate
passionate
for
advocate
diversity,
for diversity,
equity,
equity,
inclusion, and
inclusion,
belonging.
and
She's
belonging.
actively
She's
leads
actively
the
leads
initiatives and
the
serves
initiatives
as
and
a mentor
serves
for
as a
students in
mentor for
STEM
students
fields,
in STEM
working
fields,
toward
working
creating an
toward
inclusive
creating an
and
inclusive
equitable
and
environment
equitable
in
environment
healthcare
in
and
healthcare
research.
and research.
Girl, it's a lot.
Girl, that's a lot.
Thank you. Well, thank you. That was a mouthful. I didn't write that.
That's all right. But
That's
what
all
they
right.
wrote is
But what they wrote is
Yes.
powerful.
it is powerful.
It is
And when you
powerful.
sit down
And
and
when
look
you
at that,
sit
how
down
did
and
you
you look
even
at that,
get
how did
into
you
this
even
field?
get into this field?
Well, that's a great question. I would say I was always interested in biomedical engineering. I didn't know what it was when I was a child, but I was always interested in the healthcare field. So I wanted to perhaps be a doctor as a child, but then later on in high school, I realized that maybe, being a medical doctor wasn't exactly the right path for me. I wanted to do something that had a little bit more of a bigger impact in the healthcare field and something where I didn't have to necessarily work directly with patients. And so at the time, I don't even know, I don't think biomedical engineering was an accredited degree at, all the US institutions.
Okay.
So it's a newer field. It was, I won't say the time to,
I understand.
to give
I
my
understand.
age, but it was a newer field. So then when I did go to the University of Maryland for my undergraduate degree, I had learned of the field and I knew immediately that that was something I could do where I can invent a technology or a biomaterial or cancer drug delivery therapeutic or something like that and still help people. So that's really where it came down to.
So clean house.
So playing dolls wasn't a
No,
priority.
no. I mean, I did love that. Don't get me wrong. Yes, but yeah, no.
There was
Right.
something else in this
There was
world.
something else in this
Yes,
And I
world.
think that
yes.
And I
being
think that
inquisitive
being
was the
inquisitive
piece
was really
Hmm.
the
for you
piece
to be able
for
to
you
see
to
that.
be able to
So
see
when
that.
you, as a
So
little
when you,
growing
as a
up,
little
what
girl
were some
growing
of
up,
the
what
things
were
that
some of the
you saw
things that
around
you
you to
saw
take you
around
to
you
this
to take
place?
you to this
I
place?
would say visiting the doctor's office. So going there and knowing that so many people were being treated and helped, and going to the hospital when my mother was ill with, she had diabetes type 2, and understanding you have to make lifestyle changes. What are things that I can do to better help my family members? Really, that's kind of
That's
where
huge.
that
That's
came into
huge.
place. My grandmother had lung cancer, and so that was definitely the drive for me in terms of trying to figure out, um, what are the ways to cure these things. Yeah.
Right. That's right. And not only to deal with that, but life balance with what you need to do at work and the relationships that you have with
Right.
your parents. And that's really difficult sometimes when we end up at a place where it's
Mhm.
overwhelming,
Mhm.
right? So with your job, what is your basic responsibility?
Yeah, so at the FDA, as a lead reviewer, what that means is that we are responsible for reviewing any type of submission that comes in from a medical device company to see if the testing that was completed for that device shows that the device is safe and effective to be used inside of a patient. So what that means is we're looking at all types of engineering test reports. We look at the post-market side. So if there's a death event or a serious injury that happens to a patient, we're reviewing that information. We review the inspections of the facilities, their manufacturing processes, and we're taking all of that information into account. I personally lead teams of different engineers, doctors, veterinarians. I lead these teams to make a final decision to say this device can be used in a patient, whether it's for a clinical trial or for complete market use.
And so, with your position and seeing all of this work going down the pipeline, how do you fit within that structure in your job?
I am the leader of that. I'm kind of, first in line of of interacting with the companies and providing them with guidance as to what testing they need to complete. So very early stages, helping them prepare their submissions so that it has the right information in that. And then working for the next stage of actually reviewing it once it's completed and seeing, what they actually did. So I would say I'm, front of line and leading the teams to uh, to make those decisions.
And this is really important because the Food and Drug Administration deals with your food and drugs.
Right.
Right? And so, I want to say it a little louder because that we have to rely on the work that your department is doing for everything that's going into the grocery stores, into the pharmacies. Can you talk about that?
Yes, yeah. So I specifically work in interventional cardiovascular devices. That's a jargon term, but it's basically the devices that go into your heart and arteries to reopen them. So that includes things like stents, catheters. There are all types of mechanical devices, laser devices that go in there to, to unclog your arteries. But those are the types of devices that I work on. I don't have a direct contact or any type of work in the food and drug and cosmetic or tobacco product space. We have several centers, but that is my primary area of expertise and the devices that I work on.
I love it. And it sounds complex.
Yes, very complex.
And so, what got you into this area of business?
That's a great question because it was a bit of a circuitous route to interventional cardiovascular devices. I would say as an undergrad, I did work and research in a completely different field. It was drug delivery and cancer nanoparticles and creating those. So completely unrelated. It was just something I was very interested in, as I mentioned before. And then I actually did an internship at the FDA. And that is where I think it brought it, kind of a full circle moment later on in my career where I worked again on cardiovascular devices. But that internship in my senior year of my undergrad experience, that is where we were working on research on stents and drug-coated balloons. and understanding the coding processes and how that affects delivery of different drugs into patients. So it was tangentially related to my previous research, but not exactly related. It was I would say it was more so like a transferable research topic. And then in graduate school, I focused on research even more broadly, more fundamental
Really?
science, looking at just how our cells interact with different biomaterials or specific biomaterials and shape changing biomaterials and how our cells would interact with that. And I think it could be applied to anything. So I was looking at so many different options after graduate school, and I wanted to then go back home. And the FDA is around the area that was back at home for me. So when I applied, it just so happened that I had this previous experience for my internship related to cardiovascular devices and all these other research experiences that are more fundamental that could be applied to the area that I'm working in now. And so it kind of was a full circle.
Full circle.
Yeah. And
Yeah.
that's how I ended up.
And so how long have you
I
been
have been there for it's actually 6 years, I think, as of today or tomorrow. So
Okay. But that's a long time. And you found your sweet spot
I would
there.
say so. Yeah.
And so in looking at an organization that impacts our very life, right? How do we as citizens know what we're supposed to do?
I think, well, there's a lot of information out there about how to learn more about the devices that might be used to treat you. I would start with looking at different options. So if you go to your doctor and they are recommending a certain treatment, I think it's always a great idea to research that information. It is available publicly. The FDA has to put that information out, as well as the company, I believe, also.
Okay.
So, making sure that you're perhaps reading the labeling or watching some videos, perhaps even on YouTube. I love YouTube to learn about different
Education.
So just maybe doing the research of different types of technologies before you have to actually have the procedure or the treatment,
Or make a life
major life
decision.
decision, right?
Right? And that's what it is. So do you play any sports, or did you play any sports growing
Yeah,
up?
I did. I don't play any sports anymore. No, not too much. But I do run. So we just my fiance and I just ran the DC half marathon, I think, last month.
Oh,
Yes.
you really love it.
Yeah, so that's pretty much the main way we stay active, and then cycling and things like that. In high school, I played volleyball. I didn't play basketball, but yeah, just a few sports here and there, but nothing in college or anything.
I love it. I love it. I'm sorry, I got a giggle out of that. But sometimes we don't even know what we don't know. And seeing that there's something available to you, even though you go down a path and you see all these other things, but it resonated with you to be a runner, which I think is really wonderful. So when we look at where you are now, and you've been with the FDA, what's next? Are you on boards? Are you a volunteer?
Yeah. So I also want to highlight that for 2 years, while I was working at FDA as a lead reviewer, I was also leading the first diversity team for the Office of Product Evaluation and Quality, which is 1,200 employees. So I was actually selected to be one of the guidance, well, I wouldn't say guidance, but more of the consultant or expert level at the Center for Diversity, Equity, Inclusion, and Belonging. And because I was selected for that role, which was a volunteer-based role, Um, I then was asked to be in charge of our first diversity team. So that is where the rest of my work is. That's where the rest of my time kind of focuses on. And at this point, I can also say that I've with others at the agency, we are now creating the first woman of color in STEM employee resource group for the entire
Wow.
FDA. Yes. So
Wow.
I'm very excited about that. We're going to have our first event. Yes, yes, yes. So that is where all my other energy goes into. I'm also a real estate agent in Maryland.
Okay, like you've had enough time to do something else.
No. But my passion really lies in, diversity, equity, inclusion, and belonging, as well as health equity. So I'm in a lot of health equity working groups at the FDA. We're trying to address different health disparities. How can we increase or improve representation of people who look like us in clinical trials, because that's very important information.
Critical.
Absolutely critical.
We got to show
Right.
up to be able to understand where all of our resources need to go and to make certain that
Mhm.
everybody's healthy. And understanding what that really requires
Yes.
is a lot. We don't even know some of the work that you all are
Right.
doing over
Right. And there's that gap there. And so we need to have more of a relationship with patients, more communication in the community, more community outreach, more education to make sure that people are comfortable, participating in clinical trials, but also they're benefiting from being in the clinical trials, because at that, right.
in those trials.
Right.
That's
Yeah.
huge. And not everybody gets that
Right.
option.
No, they don't. That's an excellent point to your question earlier, because sometimes you might not even know that there's a trial going on for your condition, and your doctor may not be aware also, but they don't know about it. And that's the other part about going out and doing the research on your own and getting a second opinion and finding, the trial or the device that really would help you as a
Yes, right. And like I say all the time, my favorite words are, you don't even know what you don't know. So if somebody's having a trial, how do I even get my name on the list to be part of that trial? It's something that I'm in dire need of.
Mhm.
So what's next for you? I see you at Food and Drug, but I don't see you being
No.
still.
Yeah, no. Well, currently I'm in the leadership readiness program at the FDA. So I think I'm interested in leadership positions within the FDA, director roles, something related to health equity. And I think that's going to be my next step. It's going to be some type of leadership position. I'm already an acting team lead, but I don't think that's the ceiling for me for sure. It definitely has to be director, VP level or something. But I would want to stay at FDA and complete a lot of my projects, make sure I really have the impact that I want to have and leave the legacy that I want to leave at the FDA as it relates to diversity, equity, inclusion, belonging, and health equity.
And that's huge. And what you don't want is to walk away and the work's
Right.
not totally done. So you need to finish that, bring it full circle,
Yes.
right? And make it certain it's in the annals of that
Exactly.
organization.
Exactly. Yep. Yes.
Right? All right. Ariel Ash Shakor, thank you so much for taking time with us
you so
today.
much.
Do you have any last words?
No,
or
this was
comments?
great. Thank you for the opportunity to interview with you. Just thank you. Thank you so much.
Thank you. And our doors are always open.
Great. Thank you.
Thank you so much. That